Thank you for watching Inside South Florida today. I'm Lamaya Polina. We're kicking off today's show with some health facts, okay? So each year, more than 6 million people are treated for basal cell and squamous cell carcinomas at cost of more than $8 billion. These cancers are generally considered survivable, but the key is early detection and treatment, all right? A small but mighty new weapon in the battle against skin cancer can fit on the top of your finger. Dr. Raza Bakari is here to share a little bit more. Dr. Bakari, thank you so much for joining the show.
Thank you, Lamaya, for having me on your program.
No problem. So our first question is, how serious is skin cancer right here in the U.S.?
Non-melanoma skin cancer, particularly basal cell carcinoma, is the most common cancer in the United States, with nearly 5 million new cases that are diagnosed. At a given time, there are 7 million patients waiting in the queue seeking a treatment at an elaborate cost. You had mentioned 6 billion. Our information is that it is more than $15 billion is being expensed every year in the United States to treat this cancer through surgical intervention.
Very interesting. So tell us about the latest advancements in skin cancer treatment technology.
So we at Medicus Pharma are focused on bringing to market through advancing clinical FDA-approved clinical development programs by delivering a chemotherapeutic agent directly at the site of the lesion, non-invasively, using our patent-protected microneedle arrays that come, the design of these, unique design of these needles come out of Carnegie Mellon and University of Pittsburgh. We have been at it for quite some time. We have completed a safety study in 2021 to demonstrate that doxorubicin can be delivered transdermally without any serious systemic or localized side effects. We are currently in a 90-patient phase 2 study across United States and multiple sites, and we recently showed an interim analysis which is trending positively with more than 60% patients showing a clinical clearance. So we are very bullish that we are at the cusp of crossing the finish line in not so distant future by bringing a commercially viable, non-invasive treatment for the most common cancer.
Dr. Bakari, you know, skin cancer technology treatments, the research is constantly advancing. This is a pivotal moment, though. This is something really unique. So dive in more. How important is this particular advancement for people?
Clearly, this basal cell carcinoma is an outcome of being exposed to extended ultraviolet radiation coming out of sun or other tanning salons and areas, but places where are exposed to sunlight, which is mostly is face, forehead, shoulders, head and neck. So a surgical intervention is quite painful, aesthetically not very pleasing, and is also quite expensive. To be in a position to bring to market a non-invasive, relatively painless, and a cost-effective and an aesthetically pleasing treatment is a game changer, and is very likely will reshape the treatment modalities for this most common cancer. So it is particularly exciting for us that while this quest has been going on for a long time, we are ahead of the game and amongst the ones that could bring to market not just a first-in-class, but also a best-in-class treatment alternative.
Yeah, for sure. Where can we get more information, doctor?
You can come to our website at medicuspharma.com, browse through relevant information, including information on the clinical trial sites, which are not only across United States, but also now expanding in Europe and the Middle East. Basal cell carcinoma is not just an American problem, but a global problem. Wherever there is sun and exposed skin, especially fair-skinned population, that's the breeding ground of this cancer.
Yeah, yeah. Dr. Bakari, thank you so much for coming on our show. We'll see you next time, guys.
Thank you so much, Lamaya.